So I want to welcome you very warmly to this webinar this morning run by the Office for Students on intersectional approaches to support mental health for students. It's great to see so many of you here to learn about this really fascinating and important programme that the OfS has funded over the last 2 years. Just to let you know, this is the first of 2 webinars, with the other webinar taking place next Tuesday, the 13th of June at 2 p.m. Registration is still open for the second webinar, and there are different projects from the programme sharing their experiences. So it's entirely open to you if you wanted to attend both webinars, and you're very, very welcome. And there's no cap on numbers. So please do get your registration in if you'd like to do that. And both the recordings, we're recording this webinar, we'll record Tuesday's webinar, and both the recordings will be uploaded to the OfS website after Tuesday's webinar has completed. Next slide, please, colleagues. Great, thank you very much. Just watching, yep, the numbers are still coming up. So good. So a welcome to everyone who's joined since over the last couple of minutes. Just to let you know, closed captions are available. Please click the CC icon on your sort of Zoom toolbar there. Be aware that this webinar is being recorded, and recordings, as I said, of both will be available on the OfS website after Tuesday's webinar. If you'd like to ask a question, and there will be a chance for a really decent amount of Q&A with the projects after their presentations, please use the Q&A box, again, on your little Zoom toolbar, rather than the chat box to do that. Use the chat box if you'd like to speak to the events team. So if you've got any sort of technical issues or any practical questions, that can go through to the events team. So Q&A box for a question. Next slide, please. Thank you. So I'm just going to give you a very quick run through our agenda for the next hour and a quarter or so. We'll begin with a quick introduction about the OfS and our work on mental health, and how the funding programme that we're sharing and talking about today was developed. We'll then have a short presentation from our independent evaluation team, Wavehill, who are working on the programme level evaluation, and they'll give you an overview of their findings to date and some of the work that they've been doing with all of the projects. Next, we'll hear from the University of Central Lancashire, who'll be presenting on their creative mental health framework to support LGBTQ+ students. Unfortunately, this is a bit like the Oscars when someone's got to beam in a video. The project leads from UCLan can't join us today, but they have shared a really excellent video with us, so hopefully you'll enjoy that. The University of Westminster will then present on their virtual reality intervention to support first-generation students with social anxiety. I've seen their presentation. They've got some amazing images in there of how the VR has been utilised. And finally, we'll hear from Coventry University on how they've developed mental health resources for hard-to-reach groups. Each presentation will last about 7 minutes, and that will allow plenty of time for our Q&A at the end of the session. You're welcome to post questions in the Q&A box throughout the presentations, and we'll pick those up and get them all collated to ask to our presenters at the end of the session, and we'll try and get through as many of those as possible. If you want to ask a question of a particular speaker from a particular project, then please include their name or the project name or the institution name at the start of your question, and we'll make sure those questions are directed appropriately. Project leads have kindly agreed to their contact details being shared. So if any of the audience members want to follow up on anything or had any questions that weren't covered in the Q&A, you're most welcome to reach out to them individually. So thank you to the project's representatives who've been happy to do that today. Okay, next slide, please. So first, I'll begin with a short introduction to the OfS and our role in relation to student mental health and the background to this really exciting funding programme. Next slide, please. So the OfS is the independent regulator for higher education in England, and we regulate over 400 higher education providers, universities, colleges, other higher education institutions who are on our register, and ensuring that each of them is meeting their obligations towards their students. This includes maintaining high quality teaching, ensuring consumer student rights are protected, working on quality and standards, freedom of speech, financial sustainability, all of those sorts of things. And they have to meet our initial and ongoing conditions of registration, both to get onto the OfS register and then to stay registered with us. Our approach to regulation focuses on two areas, quality and standards and equality of opportunity. And we also work to ensure that every university and college has effective governance and management arrangements in place. Next slide, please. So individual institutions are clearly responsible for developing their own mental health policies and procedures and services, and we don't currently have a condition of registration on student mental health, and it's not there in the legislation that established us as the regulator, and it's not there in our regulatory framework. So what do we do? So we work at a sector level. We work through sector level regulation and funding to encourage providers and incentivise providers and provide resources to them to develop their own approaches to improvements in this area, to understand their own unique context and the needs of their students. This includes implementing a whole institution approach, having policies in place and services in place where appropriate to support students, encouraging environments where students feel comfortable to make those declarations about their mental health, and centering the needs of students through, for example, co-creation with them of those kind of services and interventions. We do have some specific functions within the broader welfare and safeguarding sphere, for example, under the public sector equality duty, through advancing equality of opportunity, through our regulation of access and participation plans, through our funding. So there's around £15 million a year of formula funding, which goes out to providers to support student mental health specifically. And in some of the projects that we've run to create effective guidance in the sector, which I'll talk a bit more about. And just to be really clear, in line with the OfS approach to regulation, we don't deal with individual cases from students in relation to mental health or wellbeing. And so you will see in this webinar how we've used our funding competitions to encourage providers to do all of those things I've just described. Next slide, please, colleagues. So there are several tools at the OfS's disposal to develop a programme for championing a safe, healthy and inclusive higher education sector for students. And the first is funding. So that's what we're all doing here today. That's what we're celebrating the end of this, this funding programme. And the funding is there to develop innovative solutions to tackling poor mental health among students. So we've had a challenge competition, we've had a funding competition, and between them around £9 million of funding has been invested in these programmes to date, with matched funding from the sector and their partners. So there's a really significant investment since 2019, both in terms of public investment and in the sector's investment of resource, which has gone into these programmes. The second way is through active provider level regulation, and that's through the access and participation plans. And our regulatory advice, our new regulatory advice that we published last month, the month before, encourages providers to consider the risks to equality of opportunity due to mental ill health. And it's recognised as a sector-wide risk in our recently published Equality of Opportunity Risk Register, the EOR, which you might have seen mention of. We've also recently published updates to Regulatory Advice 6 and Regulatory Notice 1, which give more information, advice and guidance about how providers should consider the gaps in outcomes for students with a declared mental health condition, particularly where that is so profound that it is considered as disability. The third area is through data and evidence. So we published the access and participation data dashboard, the provider level data sets, to encourage providers to take a targeted approach to addressing gaps in inequalities. The OfS also publishes data on student characteristics to underpin and understand this population, their outcomes and associations between different groups. And this includes data on students with a declared mental health condition. And this year, the National Student Survey, which, as you know, goes out to all final year students, includes a question on mental wellbeing. The fourth way is that we fund external projects to develop and support sector-wide effective practice. So we've currently got a big project being led by TASO, the Transforming Access to Student Outcomes, What Works Centre. And this is a specific What Works project for mental health. And they're developing a big digital repository of what works in different contexts for supporting student mental health. We're also funding a cohort of action learning sets, which are facilitating discussions and problem solving together between HE providers and NHS mental health services across the 7 NHS regions. And they're really trying to understand the sort of opportunities, challenges, and co-create solutions for bringing those services much more closely together. We also work with a range of partners and cross-sector groups to bring together providers, charities and government departments. And we've funded guidance. For example, we part-funded the University Mental Health Charter, led by Student Minds, and the Suicide Safer Universities guidance, which was developed by Universities UK and Papyrus. We also respond to concerns and notifications at a system level to ensure the sector is being responsive. So underpinning all of this ongoing work is to understand the barriers for groups of students accessing mental health support. In 2019, as part of our data work, we published an insight briefing on student mental health, and that brief included intersectional analysis of the access and participation data, which really revealed some stark findings on gaps in outcomes for particular groups of students with declared mental health conditions. Following on from that analysis, that was how our funded programme was developed. It was also developed to align strongly with both the Mental Health Charter and the Universities UK Mentally Healthy Universities Step Change Framework. Next slide, please. So this funding competition launched in 2021 with investment from both the Department for Education and the Department for Health and Social Care. 18 projects were awarded funding, creating a very broad portfolio of work with interventions targeting different groups of students at a range of providers. In the bidding guidance, the OfS outlined 2 key priorities. Projects should target, number 1, particular groups of students who have characteristics identified as increasing the risks of poor mental health. And number 2, groups of students who might experience more barriers to accessing support due to their course, mode of study, or other characteristics. Next slide, please. Those projects began in sort of autumn 2021. And in December 22, the independent evaluators Wavehill published a report on the programme findings related to student co-creation activities in phase 1 of the programme. So that's published. You can go away and find that on our website. Activities have continued, and from March through to August of this year, projects are evaluating now their interventions and summarising their findings. And these will be published in a final programme level evaluation report by Wavehill in early next year. We're absolutely delighted to have the opportunity to hear from some of those projects today. And it's really exciting to me to see the culmination of all of this work that we funded in the sector. So for further information and details of all 18 projects and the students they're supporting, please do head to our website. Next slide, please. So now I'd like to welcome Simon Tanner from our independent evaluation team at Wavehill to present some of their initial findings. Simon, I shall hand over to you.
Thanks very much, Amy. So my name's Simon Tanner. I'm the project manager for the evaluation of the mental health funding competition, and also I led the team that delivered the mental health challenge competition evaluation as well. If we go to the first slide, please. Thank you. Very briefly, what I'm going to concentrate on today is particular findings around student co-creation, because they're very illustrative of some of the key issues that are coming out of the evaluation work that we're running on the mental health funding competition. I'm going to cover these aspects around that. There is a lot more detail that's in the co-creation report, and there's a link on the very last slide of my presentation that will take you to that document, but equally it's all available on the OfS website. And next slide, please. So one of the key things around preventing access to student mental health support, in terms of what students have told us about those the kind of barriers that they face, but equally the things that act as barriers to them participating in some of the co-creation activity around this, are these kind of top issues, in the fact that often students don't believe their issues is serious enough. They're not sure that students could take on the position around that, and equally they don't feel that some of those staff are going to understand those support needs. But when we break that down, looking at the next slide, please, to particular groups, there's 4 kind of key issues that stand out. One is the stigma associated with admitting mental health issues, and that's particularly an issue for Black, Asian and ethnic minority students. The not serious enough situation is particularly circumstanced for first generation students, whereas confidentiality is much bigger concern for these groups of students, i.e. they're worried that if they do mention a situation around mental health and their need for support, that may not be dealt with seriously, or they may be not be protected because of that. But then equally, staff won't understand their needs is a particular issue for the groups that are highlighted on this next slide. So if we can move on to the next slide, please. In terms of the factors that students have told us that act as the key sort of reason why they get involved in co-creation, particularly around mental health, the primary one is the fact that they've got a genuine interest in improving student mental health for themselves, but equally, particularly their peers and colleagues. But equally, what they also want to be involved in is learning more about student mental health, but particularly about what their higher education provider is doing to support that. And that's something that's of particular interest to LGBT plus students, plus Black, Asian and minority ethnic students. But equally, there's an other dimension for this in the fact that they want to improve their own mental health. And incentives can work in terms of those aspects on that side. If we come on to the next slide, some of the key sort of factors here that mean you can effectively recruit students to take part in co-creation around mental health is particularly focused on identifying where you can involve trusted individuals who have shared backgrounds or reputations that those students understand and respect, that can act as persuasive factors for them being involved. As I said, providing financial incentives, but equally this should be part of an overall benefit package, which could include references and other support to those students. The other key aspect for those students was that the effective practice comes down to the fact that they're also involved in shaping what that co-creation activity actually involves. And steering it so that they feel they've got direct input all the way through the process. And there's clearly a sense that targeted approaches for particular intersectional groups really help build that sense of safe spaces that exists around that, so that they can be supported effectively whilst they're undertaking these co-creation activities. Next slide, please. Now, that effective co-creation, we know that it's being effective is where students and staff are on an even footing. They're equally respected for the views that they're putting across. The student support staff are also embedded in those co-creation opportunities to provide support, but equally hear some of the information that's coming out of that. It's also important to ensure that those staff that are involved in delivering the co-creation opportunities have appropriate support to enable them to get through. And critically, it's about avoiding that clinical language so that it's become something that's easily understandable and people don't feel neglected because of that. The particular focus around experiential focus, identifying that lived experience and sharing that within that safe space is particularly interesting and critical in terms of driving forward effective co-creation. Very much about reviewing delivery and reflecting on that with the students that are involved. Coming on to the next slide, please. In terms of the impacts, very much about improving awareness and confidence, but equally students identify themselves that they're picking up new skills, competence and friendships as a result of them participating in these activities. For those that are being targeted by this support, what they identify is that where student co-creation has been involved, there's better understanding that staff understand the barriers, but equally it's leading to better well-being and improved mental health. And just coming on to the final slide. And what we're seeing in terms of those emerging impacts is those things are still coming through. There's very much a better understanding of the barriers in this latest wave of data collection in terms of year 2. But equally, the students themselves are saying that they much better understand the student mental health issues. And over half of them are saying they develop new skills as a result. And then just that final slide, there's a link here in the pack to that co-creation report, which I hope you'll be able to read at a later date. Thank you for listening. I think it's now hand over to UCLan and their video.
That's great. Thank you so much, Simon. That was a brilliant kind of whistle-stop tour as to where you are. I know there's a huge amount of work going on there, and that the quote from that student who'd been involved in the project is extremely moving, actually, and really does show the impact that these projects have had. So next, we're going to move on to a pre-recorded video from our colleagues at the University of Central Lancashire, who designed and implemented a creative mental health framework for LGBTQ+ students. As I mentioned earlier, unfortunately, the project team haven't been able to join us today, so they won't be able to participate in the Q&A. But they are really happy to be contacted directly after the session today to answer any questions. So I will just encourage my colleagues in the back room to hop through to the video.
Hello, and thanks for letting us record our segment of the webinar. I'm Emma Speed, and I'm from the University of Central Lancashire in Preston. Joining me today is Lorraine Dinham, who's project lead and works with me on the Creative Innovation Zone. We're just going to give you a flavour of what the Creative Mental Health Framework is all about. We very much focused on the LGBTQ+ community, and we started off with an ideation. Loz is going to change the slide, I hope. There we go. We started off with an ideation with students, like a workshop, to discuss what their issues were with mental health and seeking support, any kind of stigma, that kind of thing, because we really wanted the students to inform this piece of work. We also looked at research, which you can see there, which looked at how creative practice and creativity really supports mental well-being. And so with the help of the students and academics across the university, we put together a programme of creative activities to support mental health. These are the activities we came up with. We partnered with Growing Resilience, who are a small social enterprise company. They actually use growing food and cooking food as a way to cope with stress and anxiety. And they did a bespoke programme for us working with students, which really snowballed and ended up with us appointing peer support mentors as a legacy to the programme. I'll talk a bit more about that in a minute. Big partnership for us was Tate Liverpool. They produced art therapy workshops for us. We also had podcasts. Sarah Marsh also came from the partnership with Tate Liverpool, and she's done subsequent workshops as well with students and academics. We produced 6 Sky TV programmes for our Sky TV channel with a potential viewing figure of 3 million over the 2 years. So that's quite exciting for us. Really important that we were plugged into student services. This would not have happened if we hadn't actually embedded what we were trying to achieve in the existing strategy of the university in terms of mental health. So they've been fantastic, and they have really taken on board our peer support mentors and made sure that the outputs of this programme continue. We've got a massive response from social media and network meetings with partners and other collaborators, as well as key speeches at conferences. So we really managed to raise the profile of the Creative Mental Health Framework. This is all about the Tates. You can see our students there, and you can see Loz in there actually as well, making pieces of art. And then it's not really just about, oh, I'm going to make art today. It's more about lived experiences. What are your experiences, and how can you convert those into pieces of art and physical items? And it was really skillful the way that the Tate team did that. I'm going to let Loz take over now and talk a little bit more about those workshops and what they involved.
Thanks, Emma. So as Emma mentioned earlier on, Tate Liverpool has been one of our major partners throughout the duration of this project. And a lot of the workshops that we did with our students was all around using art and creativity as a tool to support mental health and well-being. So some of the things that we looked at were the 5 steps to mental health and well-being, and also our 5 senses. Some of the things that we got to do in the workshops was to make dumplings, which are very similar to your stress balls, where each of the students were given a piece of t-shirt fabric, and on there they wrote their positive affirmations and words that reflected and made them think about mental health and well-being. We then filled those with lavender, pulses and beans and things so that they would really invigorate the five senses. Another part of one of the workshops that we did was to take all the students out into the gallery, and in particular one student was really interested in a 3D image of a soldier, and when we came back into the workshop she did a really long dumpling and she weighted it really heavy at one end with nuts and bolts and buttons, and she said she'd interpreted that as the weight of the world of the soldier having all this weight of the world on his shoulders. So I thought that was quite a poignant moment for her. We've done lots of different exciting workshops with Tate Liverpool, as you'll see on this next slide. So there's a whole host of things that we did there, and if you look around the actual corners of this slide you can see some of the images that we've done. So the first bottom left one was around the dumplings that we did. The next one is about reflecting and how artwork makes us reflect and think about things. And in the top right, you can see we've used different coloured lenses. And again, that's just to make us think about how art makes us think and feel when we look at it through different colours. Thanks, Emma. I'll hand you over to you to talk about growing resilience.
Thank you. Important to note that it wasn't exclusive to LGBTQ+. It was an intersectional programme, and we found that working with students to make the television programmes and podcasts, they made them from different diverse backgrounds, has really sort of been a knowledge transfer project as well. Growing Resilience created a very safe space on campus for people to be able to talk about their lived experiences, and it was really important to them and for us to have counsellors on hand and a support system in place should any young person be triggered by the conversations that were happening. So we made sure that was in place on campus, and we looked at healthy body, healthy mind, how to look after yourself, self-care, well-being, that kind of thing, and coping with chaos, which I think we could all do with a bit on. But it's proved a really much loved programme, the Growing Resilience section, and we now have 30, as I say, peer support mentors who are carrying on the legacy of the programme on campus. This diagram really shows that it is a co-production and interdisciplinary. It's really about a collaborative approach with academics. We're working with psychology, health and wellbeing academics who are helping us evaluate the impact of the creative practices. And we drew on the expertise of art academics, used resources, media students made the podcasts and television shows. We drew on the experience of us, which is the Creative Innovation Zone, where we believe in creativity for all across all sectors and all disciplines. And we're used to facilitating students and making ideas happen in that way using design thinking. And then we've had feedback on all the work streams. So that's podcasts, see if I remember them now, podcasts, Sky TV show, the Growing Resilience segment, and we're also just now in the middle of a finale theatre production, which has been written from the experience of one of our trans students as well, which may be taken up by the BBC, which is quite exciting. So, you know, having the high profile of those activities and the fact that the students produce them together has been a hugely positive thing for us. The evaluation plan started with getting ethics approval. Obviously, we're working with young people who have had difficulties or may have had mental health challenges already. So we needed to get approval to make sure that those support systems were there. We've used questionnaires, quantitative and qualitative evidence, and we have already seen a 30% uptake or increase in this particular LGBTQ+ community seeking support from student services and wellbeing. This is a link to one of our TV shows. We sort of did it a bit like the One Show. with an LGBTQ plus theme. So it's exploring all the different themes. This is a link to a music performance, which I think is really professional. And in it are actors talking the real words of some of our students. We're not going to play it for you now, partly because of technical reasons and partly because of time. But Grace is going to share the links that we have to a couple of student testimonials and this link in the chat or in emails later on. Thank you very much for listening today. I'm sorry we couldn't be there in person, as they say in all the best news reports, award ceremonies. But thank you very much for listening to us, and congratulations each of you on your programmes. And I'm really looking forward to actually seeing yours too. Thank you.
Oh, I feel like they're really here with us. That was a lovely presentation from colleagues from UCLan. We have had, I think because it was so realistic and we felt like they were there with us live, we have had a question in the chat for the UCLan team, which I'm afraid we can't get answered today because the team aren't with us live on the webinar. But we will be sharing their contact details at the end of the webinar. So do feel free to contact them directly with any questions that you might have. So what I'd like to do now is move us on to the presentation from Cassie Hazel, who's representing the University of Westminster today, who'll be presenting about their virtual reality intervention for first-generation students with social anxiety. So I'll pass over to Cassie. Thank you.
Hi everyone, thank you for having me today. So I'm here on behalf of the UniVRse project. So the aim of our project was to develop from scratch a new virtual reality programme, specifically for first generation students, targeting what we're calling kind of context specific social anxiety. So these students might feel very confident in their day-to-day lives, have friends, be kind of socially active, but kind of in the university setting, all that confidence kind of seems to go away. So that's what we're particularly interested in this project. So next slide, please. It's not just me on the project. We've got a really big team and of amazing people. I feel very privileged that this project has given us the chance to all work together. The University of Westminster is leading on the project, but we've got partners at Nottingham, Surrey, and Brighton Sussex Medical School as well. Next slide, please. So we decided to work with first generation students in particular, and we're defining that as any university student with no parent that has attended university. I myself am a first generation student, and a lot of the things that we learned during the project really spoke to my own kind of experience. So we know that first generation students in particular can be vulnerable to kind of poor mental health while they're studying for lots of reasons. For example, kind of lack of preparedness. So my references for university were all based on television shows, which I learned very quickly were very inaccurate. Having less of a network at home that kind of understands the university process and kind of can support you and give advice, the kind of unknown of university. And first generation students tend to have less of a kind of financial support system there, so less likely to be receiving money from home, more likely to be working alongside their studies. Next slide, please. So we were looking at kind of social anxiety, and we know that avoidance is really key in maintaining that anxiety. So it's kind of that not facing your fears helps keep those fears going. And graded exposure is a really helpful clinical intervention that can address social anxiety. So next slide, please. And the way that graded exposure works is by kind of, in a nutshell, kind of stopping people from avoiding their fears, but kind of working towards those feared situations in gradual steps. Next slide, please. The evidence base is really good for graded exposure in relation to anxiety and social anxiety, but there's a lot of issues with kind of implementing that in the university context. And virtual reality helps us get around a lot of those. So, for example, if a student finds it particularly difficult to be around large groups, it can be quite difficult to manufacture that in the real world. So to ensure that kind of you've got a full lecture theatre of students, maybe that's just my lecture, but you kind of don't have as much control over the social world. Also, confidentiality can be an issue because doing these kind of graded exposure exercises requires a therapist to be nearby, if not in the situation, and that can be quite difficult for the students. And virtual reality addresses those two things and is also quite time efficient. You don't have to kind of travel to the situation, make those kind of arrangements. You can kind of put on the VR headset and you're already in that social situation. It's also resource light. So our intervention in particular is a self-help intervention. So it doesn't require any therapist support. All of the kind of therapeutic information is included within the VR headset. Next slide, please. So in our project, what we were doing was taking this well-evidenced intervention, putting it into VR, applying it to the university context, and then evaluating that. So because we were designing the programme from scratch, we engaged in quite a lengthy co-production process with a group of first-generation students who all identified as experiencing social anxiety at university or feeling unconfident in the university setting. And then the second phase of our project was to evaluate that and develop our implementation plan. Sorry. Next slide, please. I thought it'd be really interesting just to share with you some of the triggers that our co-production group identified. And these were the things that we then graded within our programme. So unsurprisingly, things like large groups, increased anxiety. Something that was quite difficult for me to hear personally was just my presence as a lecturer, increased anxiety as well. So it's definitely something for us to reflect on, the kind of power that we can have in those teaching spaces. Things around kind of spontaneity that people can't plan for, so kind of being asked questions, kind of called upon, increased anxiety, having to initiate an interaction, again, was very anxiety inducing. And public speaking, unsurprisingly, I think was something that came up quite a lot, having to just speak in front of people. So these were all of the kind of triggers that were identified by students that we used to kind of grade our scenarios. So next slide, please. So another key part of our co-production activity was identifying what kind of parts of the university environment would they find most difficult, but also that they would like help with. I think that second part was really important for us to consider because there were aspects like going to the canteen, for example, that our co-production group identified as being difficult and anxiety inducing, but actually they reported in terms of their academic achievement and kind of employment prospects post-university, that was kind of less of an issue. They kind of prioritised these other scenarios. So we had attending a lecture, working in a group in a kind of seminar context, delivering a presentation. And the fourth one is something that I don't think we would have found if we had done this project pre-COVID, but it was engaging in an online class. These were the four situations that they prioritised as ones that were anxiety inducing that they wanted support with. And as you can kind of see from the screenshots here, these are directly from our programme. So the kind of avatar that you can see there is Sam, and Sam is the virtual mentor who acts as the kind of therapist in this context. You can choose Sam's gender and ethnicity. That's kind of the image right at the bottom. And Sam kind of takes you through a tutorial, first of all, giving you a bit of psychoeducation. And then you can choose one of these planets, which is associated with each of the scenarios I mentioned, and each having kind of 5 levels that reflect the kind of graded exposure element of the intervention. Next slide, please. So just a few screenshots to kind of show what we mean with this grading. So the image on the left there, you can see it's an empty classroom. You've got one person who's programmed to be really friendly and kind and smiley and nodding and encouraging when you're delivering a presentation, versus the other image, which is the high level, where you've got a full classroom. People are looking at you. The responses are much more neutral and a bit more distracting, so the audience is a bit more fidgety, and you can't see there just outside the screenshot there is a lecturer present as well. Next slide, please. Again, this is just an example from entering the lecture theatre. So in the earlier levels, you get to sneak in the back and sit down. But at the later levels, you're coming in from the front of the lecture theatre and you're asked to interact with a student, asking them to move their bag, and then also asked to interact with the lecturer, who asks whether you can hear them talk or not. Next slide. And just some final screenshots from our other scenarios. So the one on the left here is simulating kind of online learning. And as you progress through the levels, you're asked to turn on your mic, turn on your camera and interact. And in the group scenario, in the earlier levels, you're more of a passive member of the group, kind of receiving instruction, moving to leading the group at the kind of latest level. And next slide, please. So yeah, that's a very brief overview of the UniVRse project. We've got a web page, we've got our email address and Twitter, so please do get in touch if you want to find out more about that. And one thing I just wanted to highlight is that once we've conducted our initial evaluation, we are going to be offering universities across the UK a year's free license of the UniVRse programme. So if you are interested in your institution providing this, then please do get in touch with us, because we would love to kind of start the rollout and get some initial kind of service evaluation data. Yeah, thank you very much.
Brilliant. Thank you, Cassie. That was fascinating. And I really loved seeing the images. I think it really, really brought it to life and just made it look so, so interesting. I think we can all think about how we absolutely want to use that. And what a great offer. What a fantastic offer out to the sector as well. Thank you very much for that. We've got a couple of questions coming in already, which is fantastic. We'll be storing those up for the Q&A section. Just a reminder, you don't need to wait for the Q&A section. You can pop a question in there whenever you like while people are speaking. If it's something practical, like can we have a link to this or a link to that, then the team here in the back room will absolutely just go straight in and answer that and put lots of links in the chat for you. And if it's a question to one of our presenters, then we will store that up and ask them in the Q&A section. So moving through now, I'd like to invite Ashley Hargrave from Coventry University to present to us on their final project, developing mental health resources for hard to reach groups. Just checking that Ashley is ready.
Hello, welcome.
Brilliant.
Hi everyone.
I'll pass it over to you.
Thank you. Hi everyone. It's been really fascinating hearing all of the projects so far. So the project that I'm introducing is the introduction to the Office for Students' Mental Health Challenge at Coventry University. In terms of, next slide please. There's a large team behind us within Coventry University. I've been the project manager on this project since October 22, so took the project on partway through and was involved in the original bid and the original steering group. In terms of my background, I've worked in programme management and continuous improvement for a number of years, but during lockdown, mental health really came to the fore. Obviously, students were struggling with lockdown and staff were as well. So within the university, we formed a working group, and really that became the embryo of what formed into this mental health challenge work. So just going to describe what we did and what we achieved, and then over to you in the Q&A. Next slide, please. So our aim was to ensure that we developed a sustainable set of resources co-created with our students. Our target group was students from Black and minority ethnic backgrounds, and ensuring that they could co-create the resources and that they were supported from the point of entry to graduation. Coventry University is very diverse. We've actually got over 52% of our students are from Black and minority ethnic backgrounds, and our approach was intersectional in terms of the support and engagement of the students. Next slide, please. So in terms of our engagement to co-create the materials, there were student focus groups that were held with our students, and we also worked with student minds. So the materials were produced through those student focus groups. We engaged with students face to face, and student minds also engaged students online. And the approach we took was we went through ethical approval. We looked at ensuring that every student that came through that process had support available, because obviously talking about issues that students may have experienced or their family or friends may have experienced around mental health is an area where students, obviously it can trigger. So we made sure that students had appropriate support, both before, after and during the sessions. Essentially, we collated the materials from that research and looked at how we could create digital and hard copy materials into production. And we held a launch event on the 22nd of March to launch those materials for our students and for our staff. And then we worked continuously with project partners. So there's 6 project partners that are named in the original bid, but we've actually engaged many, many more partners as a result of the process of work that we've gone through. Next slide, please. So as part of the work, the first work package was to educate our educators. So essentially our staff, both academic staff and professional staff. So as a result of the initial work where we produced feedback from the students, we involved a working group in reviewing and understanding the content of that piece of work so that they very much felt involved from day one. It resulted in, for staff, a course which is available online to all staff within the university, and a booklet which staff can use both to understand and improve their own mental health support for students, but also is available to them online as a point of contact, so they understand both from a partnership and within the university all of the support that's available. And that booklet is available in a physical format and also as a PDF, and the digital resource, which is the training, is available to all staff through our learning platform online in-house for all staff. Next slide, please. As part of the development of the materials, we worked with an external partner called Marshalls to create a very interactive avatars around the case studies. So we had 4 case studies that came out as a result of the co-creation work with the students, and essentially those avatars and those case studies illustrate to both a member of staff or to a student the scenarios that typically a student may experience. They're created to be very, very sort of intersectional in nature, and they highlight many of the issues that Simon Tanner was talking about at the start of the seminar today. So really kind of the issues that students can experience around disclosing cultural sensitivity and the stigma, and what may or may not be happening in a certain situation is then supported through questions that the student works through in the online resource. Next slide, please. We've another package of work which is essentially supporting our students through their journey, and that is our tool which picks up if a student is not engaged. So at-risk students are identified through AI data, and a member of staff from our Student Engagement Centre will then make contact with those students and offer them support services, either directly through to our health and wellbeing team, or through support that they can offer through the phone at the time, or through our student success coaches. Next slide, please. As part of the work, we also appointed an additional welfare officer, and our welfare officer has been very successful in engaging staff and students through networking and events. So in his role, he proactively sees students for half of the week, and he also goes out and engages in events that are really highlighting the need for improved mental health and wellbeing. And in that way, he's also been able to highlight the resources that we've developed. We've also been able to get extensive feedback on those resources through surveys and ongoing support. Next slide, please. And in terms of the wider partnership model, obviously we've shared our resources with our partners, and the resources that I'm highlighting are also available today for partners across the OFS to utilise as well. But essentially, in terms of our partnership model, we have built a Think Student campaign. So we've worked with partners across the NHS, with another university which is on our doorstep, which is Warwick University. And essentially through that campaign, it's asking for NHS providers or community providers to think in terms of student health and wellbeing, and to contact the university around the support that's available. So it's very much based on the UUK recommendations for insurance, protecting staff, protecting students from the risk of suicide. So it's thinking in that context. Next slide, please. So that's my final slide. In terms of all of the resources that I've highlighted, everything is available from that link, which is a Coventry domain site. So everything that we have and can see internally on our student-facing platform, which is Aula, and our staff-facing training, is also available to our external partners. And if you do want to know any more information about any of those resources, obviously, please do get in touch. Thank you very much.
Brilliant. Thank you, Ashley. I really liked seeing those avatars and hearing all about the kind of personalization of those as well. That sounded really, really interesting. So we've now, that concludes the presentations from the project. Thank you all so much. Everyone who's presented today or sent us a video. They've been absolutely fantastic. And we've got some really good questions as well coming in, and some really kind comments as well, with people just saying, this is brilliant. We're really pleased to hear about this. So we're going to move into the Q&A part of the webinar today. So just a reminder again, use that Q&A box rather than the chat box if you'd like to ask one of our presenters a question. And feel free to direct a question to a particular presenter. So just to remind presenters to be ready to pop your cameras on and to unmute, and I will start throwing some questions around. So the first one's to Cassie. And there's a comment which says the project led by Westminster seems brilliant. Would you be willing to share an idea of the costs to develop that intervention?
Yeah. So we costed for about £85,000 to work with the VR company to produce it, because it was from scratch. We weren't using kind of existing, because sometimes you can get like kind of base packages within VR that you can then adapt. This was completely from scratch, so yeah, it was a bit costly, but I do think it's worth it. It's because it is something that's very specific to the university context. Not cheap.
No, and it's hardware and software, isn't it? So I understand, like, there's kind of infrastructure costs and developing costs, so it's not going to be a cheap business. But you have made that amazing offer to the sector for the
Yeah, well, I would just say the VR kits themselves are becoming increasingly cheap. So the kits that we have we've created the program for, you can buy from the high street, and I think they're like £400, which again, kind of out of your personal pocket is a decent amount, but for kits that kind of a couple of years ago would have been four figures, the price of them is kind of falling as they're becoming more and more tailored for kind of home use. So I think they're just going to become cheaper,
and you can use them over and over again, and they can support a really large number of students as well. So no, that's really interesting. Thanks, Cassie.
Thank you.
So I've got another question for Cassie, if that's okay. So again, another really positive comment. The project looks amazing. How realistic do you think the environments can be made? So, for example, could it look like, so obviously you've got the environments at the University of Westminster. If you were in, the University of Surrey, could you make it look like one of your lecture theatres at Surrey, for example? Yeah,
so that's completely right. So the reference kind of images were based on the Westminster kind of campus. That is one of the things that we're interested to find out in that kind of like service evaluation type data that we'd like to get, kind of partnering with other universities. One thing that makes me less worried about this is that I do think a lot of universities look quite similar. They've all got quite blank walls and kind of like white tables, dark chairs. They're not that different from my experience. So we would hope that it might translate, but that is something that we do want to kind of find out about.
Yeah, that's fair enough. And I know what you mean. Like that looks, your images look like most universities that I've stepped into, or it's close enough. But I guess if there are particular features that a provider wanted to include, then that might be an option.
Yeah, definitely something that we want to find out about. Is it, does it have to be very unique to the environment? I suppose with the kind of social anxiety focus, it is about kind of the people in the scenario that I think is the main thing that is causing people anxiety. So we would imagine that's the thing that people would be kind of focusing on more so. But like I say, we don't know. So that's a question for us to try and answer.
Okay, fab. Thanks, Cassie. I'll give you a break for a second and turn to Simon. We've got a question in just around, can you say a little bit more about what are some of the challenges that the projects have come up against that you definitely talked a bit about some of the effective practices, some of the ways that providers have overcome some of those challenges in the projects. But could you speak a little bit more about what some of the challenges and barriers were?
I think there's a couple. Particularly in terms of getting things set up, both around co-creation activities, but also setting up the work around the very intersectional focus that the mental health funding competitions had. First one is classic project setup stuff, and particularly within that, it's been about staff recruitment. Been significant challenges around recruiting members of staff. Often that's taken projects a lot longer to recruit individuals, partly because these individuals are coming from backgrounds where they might have long notice periods or already involved in a lot of things. Obviously you want that experience, but that then does mean that you need to factor in that longer period of time to recruit. Equally, the labour market at the moment is incredibly challenging for recruiters anyway. There's a lot of options out there for different people, and therefore, organisations are going to have to shout quite loudly around how to sort of attract attention to your particular piece of work, etc. And then I think that the second main area is really around student engagement and recruitment. What you're trying to do in terms of setting up these projects is overcome a lot of the previous challenges and suspicions that some students have about how higher education institutions have managed these aspects before, partly through false information that they might have picked up through the media, etc., particularly if they're coming new into university settings. But then equally, there's a lot of previous experiences that need to be unwound and overcome in terms of, you know, significant problems for CAM services, childhood adolescent mental health services out in the community, where individuals who've had previous mental health issues have experienced extremely long delays, you know, real dissatisfaction with accessing services or actually getting to speak to people. And therefore that attracts a lot of suspicion to then, well, am I just going to see this again in, you know, my higher education institution? That attached with stigma, you know, although, you know, we're having these conversations more about mental health, there's still a lot of concern about, you know, what am I exposing myself, the suspicion around how they might be treated and whether the needs will be understood, and equally worries around information sharing, etc., and those confidentiality concerns. And then it's about, you know, as Cassie's outlined, is kind of then translating that into a range of resource that you can utilize and learning in the ins and outs of VR systems, or working with the NHS and local systems and trying to understand how all those things are put together to build the right kind of partnership so that you can kind of take that forward. So I think in summary, it's very much about making sure that you allow more time for your project set up and recruitment than you perhaps expect. Secondly, it's thinking about, well, how can we engage students effectively and build co-creation as a key element to that? And then the second aspect, the final aspect, is very much about, well, how do we build the partnership approach? How do we bring those partners in, but understand that they are under particular pressures, doing their own things, that you will mean that you need to translate the messaging of your project in a way that talks to their strategic and KPI concerns that might then foster that initial engagement.
Brilliant. Thank you, Simon. Just turning to Ashley, there's a question for you around the partnership with Student Minds, which I think sounds like it was really positive. Can you say a bit more about which elements of the project you worked with them on? Yeah, that's just which elements, and about how you worked with them, and how, like, what did they advise you on? Where did they add value? Oh, you're just on mute, Ashley.
Sorry. We worked with Student Minds at the initial part of the project, working on the focus groups, because from the focus group perspective, we engage with students ourselves in-house, and Student Minds also worked to engage students remotely. So that was the initial contact, and then they were also part of our working group, steering group, going on throughout the project.
Brilliant. Thanks, Ashley. Were there any particular advantages that you found from working with Student Minds? Kind of what did they bring that was different to maybe other project partners?
Just obviously their experience across the whole sector, and we were obviously looking from our own student experience, but the experience that they had and had gathered, again, a lot of it from the pandemic and the experiences that students were having, or feeling isolated, not knowing where to go to access support. So it was really using them in the initial phase, working together collaboratively to kind of share those experiences and understand that obviously students across all wide range of institutions were experiencing similar scenarios. And then obviously in the kind of co-creation of our materials, working to make sure that we use the similar methodology for the focus groups, whether the focus groups were held on campus or Student Minds held focus groups remotely. Does that help?
Brilliant.
Does that answer the question?
It does. Thank you very much.
No problem. Thank you.
So a question to both the project, so to Ashley and Cassie, will there be any follow-up with the students who are involved in the projects, and any ways for them to share with other students what they have learned? Who wants to go first with that? Ashley, you've unmuted. Do you want to take that one first?
I'm happy to talk about that. So essentially, in terms of students that were involved in the project, we involved students in the event that we held to disseminate the resources. So students got the opportunity that had attended the focus groups to feedback on the materials. We held the focus groups, and they were involved with Student Minds and with your Students' Union and kind of how those materials were being presented. We kept in touch with students, but many of our students who were involved in the initial work were final year students. So by the time the life cycle came to we were actually launching our event, those students had moved on. So unfortunately, we reached out to every student that had been involved face to face, and there was an opportunity that if they did want to attend the event and share some of their experiences. But I think it's very much the nature of student population. Obviously, people do move on. The good news is you graduate and you move on, you get a job. But what we also did in the final phases of the project, there was a student intern who worked closely with me. So a student who was doing a business project management degree, he worked alongside myself and the wider team to review the resources, and he also attended our open event, and he also shared the resources within his peer networks. So that was really invaluable, and he also looked at other resources. And interestingly, Cassie's project I'm really excited about, and I'm really excited about that opportunity that you're offering today, Cassie, because he actually highlighted as part of that piece of work how invaluable that could be for us going forward. So it feels like we've sort of come full circle in that was one of our own internal recommendations, and you're able to offer that for free for us to trial for a year, because I think that would be amazing.
Thank you. Yeah, and just to kind of echo what you're saying, yeah, a lot of our students, yeah, have kind of left the university now. So we kind of took personal email addresses, but it's quite hard to kind of keep in touch with them. One of the co-production students is going to be a co-author on the paper that we'll be writing, which I think is really lovely. They're going to kind of bring their experience of the co-production process into the paper. But yeah, I think that's one of the issues with kind of student research is you have got a very fixed window with which to kind of run stuff. So even kind of doing the evaluation, trying to do that over the kind of the extended summer period is just a no-go. It's not going to happen. So you have to really work on your timings with student research and make sure you're kind of launching it at the right time when they're around, but also when they're not too pressured, and kind of make sure you're sensitive to when they're leaving or kind of on breaks and stuff. So yeah. Brilliant, thank you.
I've just got a quick follow-up for you, Cassie, on with thanks for the offer to share the intervention with other institutions. Do you have any idea of how much this would cost an institution to run annually after the free period of a year?
Good question that I don't have an answer to at the moment. I think kind of related to something that Simon was saying in terms of setup and contracts and intellectual property contracts, it's quite complicated. And so we've got to the point where we're agreed that there's a year free license. Beyond that, we're not sure yet, but equally, we're not going to offer it out to universities until we've done our initial evaluation, because I just think that wouldn't be appropriate for us to do that. We just need to check everything's working okay before we kind of release it. So it'd be great for people to kind of log their interest, and then once we've kind of done our initial evaluation, we can kind of take people up on that and let them know what it'll be afterwards. But universities would need to be providing their own VR kits.
Sure thing. Oh, that's really helpful, and I think that all sounds right. You need to do your due diligence, your evaluation, all of that before you can letting it out into the wild, as they say. I've got one last question, and then we're going to have to wrap up for today. So if you can I keep it a little bit succinct, but to Cassie and to Ashley, what's next? What's next for the projects? What's happening in this space in your institutions next? That would be great to finish up on.
Just really building on what we've done to ensure that it's business as usual. So it doesn't stop. Obviously, there's ongoing work, and ensuring that the learning from this is embedded into how we work going forward is key, and it is something we've reflected on within our evaluation. And yeah, it's business as usual, really, from now on.
Yeah, and then for us, so we've got our kind of initial feasibility evaluation, and then we're going to be running a pilot trial starting next semester. And then after that, we feel like we're going to be in a place to kind of collect that service evaluation type data, offering it to other universities. The longer term plan for us is to apply for some further research funding to continue to develop the programme, because we've developed it for first generation students in this context. But we actually think it can be applicable to lots of students who find university difficult, and even those that haven't reached university yet but aren't sure whether they want to go, that kind of helping that preparedness beforehand. So the plan is to apply for further funding to further refine our programme and then kind of do a more full-scale evaluation. But while that's going on, we'll continue to kind of offer it at Westminster and other universities.
Brilliant. Thanks, Cassie. Simon, you've popped your hand up.
Yeah, it was just quickly, just in terms of what we found from the challenge competition, were the two key things that really helps kind of embed this, the learning from this. One is looking, you know, if your student support service is not already involved in your project, then look to engage them as quickly as possible and share the learning directly, because it's not just applicable to their support around mental health services. There's loads of learning in this about the way in which they can make their wider service offer more applicable to a range of students. And then the second area is very much about, if you're not already involved with local NHS partnerships, then look to share this learning out through them, because you know, most universities are located in areas, particularly the campus style universities, where the influx of students has a massive impact upon the NHS challenges every year. And therefore, if you can identify ways in which some of those might be mitigated through the learning that you've got from your project, that could really help build some really important bridges with NHS partners that then helps the wider support services within the university, but equally the community services that are available to your student bodies to be improved and enhanced hand in hand with NHS services, public health services and other local authority services. That means that there's a, you know, a more strategic approach to the delivery and supporting these. That's certainly what we saw in the challenge competition, where those things happened. It made a real difference and helped really sustain some of the things going forward into the future.
That is a great final note, Simon, with some really good advice for practitioners and leaders who are on this webinar. So that concludes the Q&A. That concludes our webinar for today. Our presenters have very kindly agreed to share their contact details, so please do get in touch with them if you've had any further questions. I'm aware I haven't got through all of the questions that have been asked, so again, you might want to save yours up and email one of the presenters or one of the projects. We'll be sharing the recordings of both this and next Tuesday's webinar towards the end of next week. If you would like to know about when those are published, you can sign up to our OfS alerts service. And that will also give you other OfS news. And we've said things like if there's any future funding opportunities, that will also come out through OfS alerts. If you'd like to contact the OfS team regarding our work on student mental health, we'll be sharing email addresses at the end of this presentation and in the chat. After this event has ended, we'll circulate an evaluation survey and we welcome any feedback that you might have on this event. And finally, it just remains to me to say thank you so much for listening today. Thank you so much for your questions and for being part of the event. We'll keep it open for another couple of minutes, just if you want to copy and paste anything out of the chat. Thank you so much to our presenters, and thank you so much to the OfS team who've been in the background, making sure this event and all the nuts and bolts of it all run so smoothly. But I hope you all have a fantastic rest of your day, and we'll see you again at the next one. Goodbye.